operator's hand, how we are going to hold the alcoholus, and how we are going to hold the forceps and then extract the teeth. Okay. So first we will see the arrangement of instruments. So first, when you arrange your tray, you need to have an orderly manner to arrange the instruments. Okay. So first is you are going to arrange the diagnostic instruments. That is your mouth mirror, your explorer or your probe, then your tweezer. Okay. So this will, in this way only you will perform your procedure. So that is the reason we arrange it in this manner. Okay. So first your diagnostics is over. Okay. So next will be your syringe for giving your local anesthesia. The third will be your, what is this instrument? Periosteal elevator. Okay. So we will be elevating the mucoperiosteal flap with this. So we will be arranging it in the next order. Following elevation, what is the next procedure? Extraction of the tooth. So we will be arranging the extraction forceps. Apart from this, there will be another tray here which you can arrange your cotton or cotton holder can be there. So within a kidney tray. Okay. So this is how you will arrange your instrument. So first is your syringe. And without touching the syringe, you need to drop it down. So this should be done before gloving up. Okay. So this will be a sterile syringe now. So with this gloved hand, you can hold the syringe. Okay. Next we will see how to load the local anesthesia into the syringe. Okay. What are the parts of the syringe? Yes. This is the cartridge. Cartridge or the barrel you can say. Okay. And this purple portion is the hub of the needle. And this is your needle. Okay. So these are the parts of the syringe. Now for loading the LA, you need to have another person along with you to help you load the LA. Okay. Why? Because this is a sterile syringe. Okay. LA bottle, is it sterile? No, right? So because of that only, another ungloved person will hold the LA bottle for you, and you can hold the syringe in your hand and load the LA. Okay. So for loading the LA, the person who is holding the LA bottle should hold it upside down. Hold it upside down. So this is how they will present the LA bottle to you. Okay. Okay. So this is how they will hold the LA bottle. So now the operator will remove the needle portion of the syringe and then completely lock it inside. Okay. And the person who is helping you load the LA will hold the hub of the needle. Why? Because it is again unsterile. Okay. They will hold only that portion and they will not touch the syringe, and they will lock it, give a twist. Okay. Now it is completely locked. Okay. Now following which I will start loading my local anesthesia. Now after sufficient amount of local anesthesia is taken in, then again that person will unscrew it and take it off. So completely the syringe is sterile now. Okay. Following which I will insert the needle and lock the needle inside. So this is how you load the local anesthetic solution. Okay. And keep it onto the tray. Okay. So next we will see the chair position, patient position and the operator position. Okay. So first when you are doing the procedure for maxilla, how the maxilla should be angulated. First question is that. So when she opens the mouth, the maxilla is almost at a 45-degree angulation. Okay. So maxilla will be at 45-degree angulation to the floor. Okay. So this is how your maxilla should be angulated. So on the side you have to position the patient. Okay. And when you see the mandible will be parallel to the floor. So this is the first step you have to see when you are positioning the patient. Okay. So when you make the patient sit, you have to be in a position that maxilla is at 45 to 60-degree angulation. Mandible is parallel. Okay. So next is the position. Okay. So this is the patient position. Okay. Next, how the maxilla should be in relation to the operator. That is the second. Okay. So do you know how the maxilla will be positioned to the operator? The maxilla should be almost below the shoulder level, 16 inches below the shoulder level of the operator. Okay. So how will be the relation? Any idea? Below the elbow level, that is 6 inches below the elbow level. Okay. So can you see my elbow now? And the position of the mandible is below my elbow level, 6 inches below my elbow level. So that is how you can hold and extract. Okay, so this is your chair position. So first we will see about maxilla. So for maxilla, how the patient chair should be? Shoulder level. Okay. So all these things have to be done before you start all your anesthetic procedure and everything. Before even gloving up, you should start doing all these procedures. Okay. So first you will use your diagnostics to check what tooth is there. Always confirm the tooth which you are being allotted. Okay. You have to take the OP, find out which tooth is being extracted, and then see. Okay. So first, for example, she has a D8 premolar, or for example, you are going to extract the incisor for this patient. You are going to see and explore the site. Okay, your diagnostics. Second will be your local anesthetic technique. Okay, so for maxillary extraction, you will be most commonly going for a simple infiltration. Okay, so infiltration means what? What is your purpose of giving the infiltration? Single finger. Only the terminal nerve endings will be anesthetized. Okay, so for simple tooth extraction, you will anesthetize only the terminal nerve endings, and then you will extract the tooth. Okay, so for subperiosteal infiltration, what you will do? You will angulate. So for subperiosteal infiltration, can you see there is an angulation of the needle? Do you know what it is? Bevel, yes. So when you give an injection or infiltration or any other block, the bevel should be facing the bone. Okay, that is when the local anesthetic will go into your target area. If the bevel is facing away from the bone, they will go towards the tissue. So the terminal nerve endings will not be anesthetized. So always remember, if this is the teeth, the bevel should be facing towards the bone. So that is how you should insert the needle into the soft tissue. Okay. So before starting the anesthesia, you will be giving a topical anesthesia if the patient is anxious, and then you will start with the LA. Okay. So for supraperiosteal infiltration, what will you do? First thing, for example, if it is a central incisor, okay, your needle should always be parallel to the tooth to be extracted. Okay. For example, you are giving infiltration for incisor. Okay, your needle should be parallel to the tooth you are going to insert. Okay, parallelly you have to see, first retract the tissue and see the junction of the alveolar mucosa and the, what is this? Labial mucosa. Okay, so height of mucobuccal fold will be your area of insertion. Okay, so when you lift out the tissue, you can see the junction. Okay, in that junction only you are going to insert, right? So you are going to keep the syringe, keep the syringe parallel to the tooth. Okay, and insert at the depth of the mucobuccal fold, right? So this will be the area of insertion. Okay, so insert it a few millimeters, and then what will be the next step? Aspiration. Good. What is the purpose of doing an aspiration?
Blood vessel.
You should confirm that if the local anesthesia is somewhere in the vicinity of a blood vessel. Okay, so if it is on a blood vessel or puncturing the blood vessel, your anesthesia will go into the vessel. Okay, so to prevent that, you insert the needle and then you aspirate. Okay, if the blood comes into this syringe, what does that mean? That means the aspiration is positive. If there is no blood, it is negative. Okay, you should always aspirate in two planes. I'll tell you what is two planes means. So first your bevel is facing towards the bone. You're inserting and aspirating. It is negative. Again you rotate the needle facing the bevel outside and then you re-aspirate again. Okay, so this is how you check the aspiration in two planes. Okay, and then you redirect it back and then you start injecting the LA, confirming that there is no blood vessel nearby. Okay, you start injecting the LA and then you can withdraw the needle slowly. This is how you give for a labial or a buccal infiltration. Similarly for premolar, Similarly for premolar, again you insert it parallel to the tooth. You go at the height of the mucobuccal fold, aspirate and then give. Similarly for molar, again you have to keep it almost as parallel to the tooth, insert, aspirate, give. Okay. Similarly for the other quadrant also, you will be going parallel to the tooth, insert at the height of mucobuccal fold, aspirate and give the local anesthetic solution. Okay. Any doubts in this? Aspiration, positive aspiration while giving an infiltration, that means you are touching the blood vessel or you punctured the blood vessel. In that case, you have to withdraw the needle little bit, redirect it and then give. Okay, again you have to aspirate in two planes, making sure that you are not nearby any blood vessel. Okay, so this is how you should prevent any aspiration or treat any aspiration. Okay, what will happen if there is any positive aspiration? You have punctured the blood vessel, so there will be hematoma formation. Okay, apart from that, it will enter into the systemic circulation. The local anesthesia will enter into the systemic circulation and cause systemic toxicity. Okay, your main target is to anesthetize the nerve, not to enter into the blood vessel. Okay, so you cannot enter, give the LA into the blood vessel. To prevent that only we do this aspiration. Okay, clear? For anesthetizing the maxillary teeth, what are the palatal anesthesia techniques you can give? So for anteriors, you can go for a nasopalatine nerve block. Okay, for posteriors, you can go for a greater palatine nerve block. Okay, so to anesthetize the nasopalatine nerve block, what you have to see is the incisive papilla. Okay, on the palatal aspect between the two central incisors. Okay, so locate the incisive papilla and insert the needle as parallel to the central incisor and go little bit deeper, you will encounter the nasopalatine foramen. Okay, this will be a very short insertion only, not more. Okay, because the palatal soft tissues will be more adherent. Okay, the foramen is very nearby, so you just insert just little bit lateral to the incisive papilla. Okay, you will enter, when you go deeper, you will encounter the nasopalatine foramen where the nasopalatine nerves and vessels will be there. Again aspirate and then give. For greater palatine, always when you start the procedure or when you are learning stage, you can use the needle cap to locate the greater palatine foramen. Okay, usually when you see the greater palatine foramen, you should take the back side of the needle cap and then from the palatal aspect you can see a junction of the hard palate and the alveolar mucosa. Okay, there will be always a junction. This is the junction. Okay, the palatal mucosa and the alveolar mucosa will join at a horizontal junction. So in that junction you keep the cap of the syringe at the level of the first molar and then you run the cap backwards. Okay, you keep it at the junction, run it backwards. Yeah, can you see the dip here? At one point near the third molar it will dip inside. That is suggestive that is the greater palatine foramen. So this is how you have to locate the foramen. Okay, so you have to insert the cap and then run it backwards from the first molar and then you will feel a dip at the third molar region.